Now we are moving on in our third section to some of the rare form of thermal injuries, that is electrical and cold injuries, because they are although rare but also very important at times. We'll be briefly going through how to recognize the electrical injuries and how to manage these electrical and cold injuries such as frostnip, frostbite and severe cold injuries. Now, electrical burns, they are very common, especially in the case of children. This is usually due to contact between electrical source and the earth. And physiological effects are actually related to the first and foremost is the amount and duration of the current. Whether the patient has suffered that from high tension wires, which may be containing 10,000 or 15,000 volts of electricity, which will be a very high amount, and how much was the duration. That is also determines the greater the duration and greater the voltage would probably result in increased amount of damage towards the deeper tissue, especially the muscles, the nerves, and eventually leads to necrosis of these tissues. This could be type of current, which is alternate current or direct current. Direct current is usually a low voltage. Alternate current has higher voltage, so it's more damaging and path of the current flow. Was it that patient, if for example, patient had caught a high tension wire from his right hand and has actually the current has exited through axilla of the right side, that would mean only the right arm would be damaged, really the heart and areas won't be damaged. But if the patient's exit of the current is through the left foot, this means the whole body would be involved and probably increased damage would be present. So path of the current flow is also important in determining along with amount, duration of the current, and whether it is the AC or DC current. Now, how to recognize this problem? The principle of all this trauma remains the same. That is the ABC of Italy's. It starts with the airway and cervical spine. Now, what is important is that usually with the high voltage current, the patient sometimes thrown away as well. So we need to remember there may be associated injuries along with the electrical injury as well. So this may be associated with prolonged apnea. So the first and foremost is management of airway obstruction. How to assess this? If we have airway is blocked, the option is to go for endotracheal tube. That is, you secure the airway first. Along with musculoskeletal injuries. Why they are important? Because usually when the patient is thrown, this may be associated with multiple fractures. Could be of either limb fractures as well. So we need to assess the airway obstruction along with the musculoskeletal injuries. Long bones should be examined. X-ray should be done for musculoskeletal fractures as well. And usually they are carried out to depending upon whether it's a femur or what type of injury is involved. If it's leg, usually tibia fracture is associated with it as well. Now coming to the management. Management again of any trauma starts with the airway control, that is airway and then cervical spine, then comes breathing, then comes circulation, then disability, and then lastly the environment and temperature control. So important is avoid respiratory injury as well. Sometimes what is usually noted is that a patient got stuck with a high tension wire. There was somebody who was trying to save him as well, and as a result, not only that person, the rescuer also got some injuries as well. So usually it's important to avoid a rescue injury, especially in case of electrical injury. First and foremost is always the A, that is to secure the airway. An airway can be secured by use of passing of ETT. Then protect the cervical spine. It must be kept protected until unless proven otherwise that there is no cervical spine injury. For the breathing, you have to give oxygen and ventilate the patient. If it is not associated with any deadly injuries of the respiratory and breathing mechanisms such as pneumothorax, then we can move on to circulation. Circulation, IV line has to be maintained. 2 large IV cannulas must be maintained to the patients and should be given fluids as well, because usually electrical injury will cause rhabdomyolysis. This will lead to muscle necrosis, and muscle necrosis eventually may lead to problems such as hyperkalemia and renal failure. So fluids must be given to these patients. Neurologically, they must be assessed, and then once we have completed the primary survey, then we can go for the specific problem. For example, if there is dead tissue, we can go for surgical debridement. We may require fasciotomies, Why? Because usually with edema, they may result in myonecrosis. This may be associated with compartment syndrome. So usually fasciotomies are always required as well. Urinary catheter must be passed. That is part of the primary survey because we need to enter the input and output. And why we need to maintain the monitor the input output, because usually the myonecrosis leads to renal failure, and we should avoid increased myonecrosis as well, because this may eventually lead to renal failure. Urine dipstick can be done for the checking of levels of urine myoglobin, but myoglobinuria is very common with associated electrical injuries, and increased myoglobinuria means there's increased injury, and we have to make it sure that patients maintaining its renal output. Now coming to the cold injuries. Now they are also very important, although very rare, but they can occur as well, and especially the three forms which exist. One is the frost nip, frostbite, and which could be superficial, which is first or second degree, or it could be the deep frostbite, which is usually third and fourth degree associated with it, or it could be a non-freezing injury in which this was the patient had some kind of a chilblains and these kind of injury which we associated with that the tissues may not be frozen, but it's associated with cold injuries. Now coming to the management. Usually these cold injuries associated with hypothermia. So hypothermia must be managed. Now it could be a simple hypothermia, and there is mild hypothermia, and it could be severe hypothermia. Management principles are always the same. That is, you have to start with the airway and cervical spine. You have to secure the airway in these patients as well, oxygenate and ventilate the patients, and gain IV access, that is A, B, and C. Once you are done with this, you're treating the shock with warm fluids and IV fluids, which is important in the case of hypothermia. This could be mild and moderate hypothermia, which can be treated with heated blankets, warm baths, or forced hot air, or warm bath rewarming. Usually these may be associated with actually localized tissue damage, and we have to sometimes this localized tissue damage may produce edema or some kind of compartment syndrome, so we have to be look out for that as well. Now coming to the management of severe hypothermia or hypothermic cardiac arrest. Because if the temperature falls below a certain degree, this may eventually lead to cardiac arrest as well. So that can be managed by extracorporeal blood rewarming, left side thoracotomy followed by pleural cavity irrigation, thoracic lavage or hemodialysis with warm fluids, repeated peritoneal dialysis with the warm fluids, and we may have to administer humidified air which may be heated to 42 degrees Celsius, and per antral fluids which can be warmed up to 43 degrees Celsius can be given as well. But severe hypothermia is an emergency, and it has to be dealt as quickly as possible, because this could be eventually can lead to cardiac arrest and even the death of the patient who is suffering from this. In this section, we have briefly gone through the management of electrical and other injuries of the burns, especially with the case of the electrical injury. We have to make it sure that we have to perform the management of all the thermal and electrical injuries is such that you start the ATLS protocols and start with the airway secure. Once the airway is secure and cervical spine is protected, then you go towards the breathing and then the circulation. Then we may have to go for specific management with electrical injuries as well, such as fasciotomy, such as debridement because of increased myonecrosis as well. In case of electrical injury, we have to be on lookout for rhabdomyolysis, eventually leading to renal failure. Thank you very much. Keep watching sqadia.com.